Right. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting speaking sessions and we have with us Dr. Sreedhar Bommineni from Bahamas. And Dr. Sreedhar.
Yes, good morning.
Good morning. Yeah, you can start when you're ready.
Yeah, how can I address the patient?
You can call me Mr. Lincoln because my name is Abraham Lincoln and I'm 45 years old.
Thank you. Start.
Yes, of course.
Good morning. I'm Dr. Bommineni, one of the doctors in this clinic. Mr. Lincoln, you had a heart attack 2 weeks ago and you were treated and you recovered well and discharged home. I believe we are here to discuss about something very important. How can I help you?
Yeah, doctor, I have felt very much weaker and extremely tired since the heart attack. I'm extremely worried that any physical activity, for instance, walking, gardening, or swimming, or any other activity like that, might bring on another heart attack.
Yeah, I can understand, Mr. Lincoln. I can imagine how you feel, but I'm reassuring you that so this is a normal process after the heart attack. Usually it takes 4 to 6 weeks to return back to your full energy levels. So it's a process, it takes time. And meanwhile, so we have to focus on certain things to strengthen ourselves physically and physically. Do you understand?
Yes, doctor, but first of all, yeah, I'd like to know how much physical activity is advisable in my case.
Yeah, that's a very valid question, Mr. Lincoln. Yeah, especially for your problem, I would recommend you to start with moderate physical activity. That is like having slight walking around, like less than half an hour. And once you start to do gradually, you can recover and you can increase your pace. And that's the one important aspect. And at the same time, so you have to like increase your overall health. For that to have to do other measures too. Would you like me to inform that too?
Yes, doctor. I need your suggestions in this regard. What am I supposed to do?
Okay. So it's a multidisciplinary approach. It starts, one is physical activity, and the second one is your diet and lifestyle modification. Especially how to cut down the diet which is high in cholesterol. And third one, the medications. You should be compliant with your medications. And especially regarding your physical activity, what I would suggest you to join cardiac rehabilitation program. In this program, where they're going to increase your exercise tolerance under supervision, so gradually you can get more strength and more endurance to do your exercise. Are you with me, Mr. Lincoln?
Yeah, doctor, of course, what you say is reasonable, but I am an office worker and I sit at a desk all day. I don't get much exercise at work. In this case, what am I supposed to do?
Yes, so at your work, you have to inform to your supervisor about your condition, and so you have to make workplace adjustments for you because this is a time where it's a challenge for both emotionally and physically. So you should inform your supervisor to get assistance for your recovery. Is that okay, Mr. Lincoln?
That's fine, doctor, but I'm worried about having another episode of heart attack. I'd like to know what I can do to reduce the risk of further attacks.
Yeah, that's a very valid question. It's very important to know. So, what I can recommend for you, the first thing, yes, it's all changes with starts with the lifestyle and especially the diet. You have to use more greens, more green vegetables, and also like whole grains and especially the physical activity, as I told you earlier, to join in the cardiac rehabilitation program, and then medications. Once you do all these things combined, they can increase your heart health, then increase your tolerance. Then once you do this one, so there is no chance of getting your problem again. So it's always prevention is better than cure. So once you stick to these policies, then it's unlikely you're going to get a next attack. Do you understand, Mr. Lincoln?
Yeah, the information has been extremely helpful. I'll try to gradually do more exercise, and I'll look into the rehabilitation program as you suggested. Thank you very much, doctor. Is there anything else that you need to tell me?
I'm always here to help you. If you need any other information, any other help, I'm ready to offer you. Don't hesitate to ask me. Thank you very much.
Right, that's very nice, doctor. Thank you for your care and concern, and especially for your suggestions that you have given me. Thank you once again.
Thank you.
Yes, Dr. Sreedhar Bommineni. Yeah. So to tell you frankly, you have done well. The fluency is very well maintained throughout. And then you're speaking in a flow without any hesitation, without any pauses and breaks, without any confusion, and without any unnecessary sounds like something like that. And the flow is excellently maintained, maybe because you are well read and you are speaking normally with many people in English in your daily life, that is making this possible. And second thing is the accuracy. I'm really surprised at your accuracy, because I was trying to find some mistakes, identify some mistakes, but yeah, I was thinking about many other things also. Maybe I did not catch mistakes so far, and I really am pleased with your performance. Maybe after taking the transcript, maybe we can find out some mistakes. That's different thing. That's in the second round. We'll see. I'm going to get the print audio script, and we have our autopilot, artificial intelligence. It's going to type everything and provide us the dialogue. Okay, as Dr. Sreedhar Bommineni, an interlocutor grandmaster. So we'll get the dialogue, full dialogue, and including my suggestions, which I'm going to give you now. Right. Next one, the grammar. Grammar, you're well versed with grammar. And the thing is, it is better, but definitely not the best. That I can tell you frankly.
Yes.
Now, how you can improvise this is, you take two ordinary sentences, say the relation, show the relation, and use the marker or connector accordingly. You were diagnosed with a myocardial infarction. Consequently, you are provided the medication. So consequently, and therefore, so, since, as, because. So you can use these connectors to join the sentences.
Yes, thank you.
You were compliant with medication, but the progress was not according to the expectations, because you did not do regular physical exercises. Though you were compliant with medications, the results were not according to the expectations, just because you were not exercising properly on a daily basis. Both medication compliance as well as regular physical exercises, in addition to dietary regimen, are equally important. You cannot neglect, you cannot ignore something which is very important. because this is an equally important component for your progress. So this is what is called quality. You deserve A grade or at least a B plus. Don't just bargain for B grade. Don't settle for less when you are capable for more, and you are worthy to get that. So try your level best and try to implement these suggestions which I am giving you. So this is related to grammar. And the next one is vocabulary. Vocabulary, your words are better than any other student. So how you can improve your vocabulary, level of vocabulary? The levels are 6 levels. A1, A2. A1 will give you 0 to 99. A2 level will give you 100 to 199. B1 will give you 200 to 299. B2 level will give you 300 to 349. And C1 will give you 350 to 450. Whereas C2 will give you 450 to 500. These are the levels which you will get when you use this vocabulary. For example, you can say recurrence of symptoms. The symptoms recur, R-E-C-U-R. Recur is a C2 vocabulary. These symptoms come again and again is normal, but these symptoms recur. Recur is a special word. When you use the word recur, it will avoid many other words. And next, for example, you can use many words like this. Many words like this. Compliance. Compliance. Medication compliance is suggested. Medication compliance. Compliance. Follow the suggestions. Follow is very simple. So compliance is a very special word. Not everyone can use. So it is better that you use such a C1, C2 vocabulary to level up your grades. So that is what I tell you regarding vocabulary. Regarding pronunciation, I don't have much to say because you're doing well. The message is passed on. It's definitely not a native speaker's style, but it is near native. So almost everything can be understood. Some pronunciation errors are there, but we cannot, jump very high. But it's okay. It's okay. There's no problem with your pronunciation, according to my expectations. It's okay. You can improve. So how can you improve your pronunciation? If you are interested, is you switch on the television, BBC or CNN or some other news channel, and then you listen to the native speakers videos, and try to repeat the words, phrases, and parts of the sentence. Don't try to speak everything, just catch 2 or 3 words and try to repeat after the speaker. I'm telling you, listen, not watch. Don't see. Turn some other side and just listen and just repeat, so you can get the pronunciation patterns. So that will enhance your pronunciation. So grammar, vocabulary, and pronunciation. Then fluency, I have told you, and accuracy. Accuracy is of 3 types. First one is accuracy related to grammar, accuracy related to vocabulary, accuracy related to pronunciation. So these are the 3 things which you can follow, and you can improve your accuracy. That is how you can enhance your quality. Then you are using active voice most of the time, maybe 90% active voice, or even more than that. You can use passive voice. Passive voice is recommended. I will give you some suggestions. Suggestions will be given. I will give you. I only am giving, you are only listening. So why should I tell I will give you? Explanation will be provided. Procedure will be explained. Education will be provided. Counseling will be given. So passive voice, you will avoid these personal pronouns. Passive voice will avoid personal pronouns, I, we, you. So when you use more of personal pronouns, it will become informal. So in formal style, avoid the person who is speaking and the person who is speaking to, both are not that much important. The subject which you are speaking is more important. For example, I will prescribe some medications to you. Yeah, that's clear. You, that's also clear. Which is important? I is important, or you is important, or medications are important. Which is important? I is not important anymore because I'm only speaking. So you need not say, I will prescribe. I will prescribe you. Yeah, you are only important. Already we know that I'm prescribing you only, not to some other Tom, Dick, and Harry. I'm prescribing you only. So therefore, you is also dormant, unimportant. In this particular sentence, I will prescribe some medications to you. So medications are important. This is the new topic which has come in this particular sentence. So start the sentence with medications. Medications will be prescribed. I hope you understand, Mr. Sreedhar Bommineni.
Yes, yes.
It's very important. As a doctor, you should understand that in this particular sentence, what is important, you have to identify. And you should use that one as the subject of the sentence and use passive voice. That gives importance to that particular point. Because I is there from the beginning of the role play till the end of the role play. You also is there from the beginning of the role play to the end of the role play. That means the doctor is there, the patient is there, both are there from the beginning to the end. That means in every sentence I is there, every sentence you is there. So you need not repeat these words time and again. It weakens the strength of the presentation. I hope you understand the gist of my message.
Yes.
So this, you are a student who has subscribed for this course. You deserve quality. So you are getting the quality. There are many doctors who are teaching OET. There are many nurses who are teaching OET. But as a doctor, you will never go to a nurse to learn, prepare for OET. That's very clear. Now, I want to tell you one thing. Will you allow a mathematics teacher to teach English for your 5th grade son?
No.
Why? Can you tell me the reason?
Because of the profession and the experience.
A mathematics teacher cannot teach English. He's a teacher, but still he cannot teach English. Then how can a doctor or nurse teach English? That's the difference. That's the difference. They're teaching. It doesn't mean that they're not professionally qualified. They're not academically qualified. They're not professionally experienced. 3 things they are lacking. First one is they're not masters in English, or at least bachelors in English. They're bachelors in medicine or masters in medicine. They're not specialists in English language. They're common people in English language. Number 1. So academically, they're not qualified to teach English. Number 2, academic qualification. Is masters in English. Professional qualification, teacher, a B.Ed or an M.Ed must be there. So they know the techniques of teaching, how to teach, what to teach, the psychology of education, the philosophy of education, the techniques of education, educational technology, techniques, tricks, and all these things. Okay, this is taught in education. So these doctors and these nurses are not well qualified. They don't know the tricks, techniques, tips to make you understand and get you captivated by the subject. They should know what to teach, when and how to teach, the steps and the procedures. So they are not qualified professionally. Then experience wise, they are doctors, they are nurses, they have a lot of experience in doing nursing or medicine, but they're not experienced in teaching English. Maybe for the time being they're teaching English, but they don't qualify. So this is the weak area. But now you came Why I'm explaining all these things is because you will start respecting the quality. They start accepting the quality, and then you will imbibe. You can you get that subject, and you will put it, infuse into the subject. Whatever I'm telling you is very important for you. Maybe, who knows, you may get 460 in speaking. So definitely you can get. So implement all the suggestions given by me. And I'm going to, now there are 3 phases. First one is doing the role play that we have done. Then next, getting the feedback, general feedback, which I have given you now, general feedback. Then next, final feedback will be when I have the script in front of me on the computer, and you'll be watching that, and I'll be marking red with the mistakes, and marking blue with the suggestions and improvements, and giving additional quality, changing the active voice into passive voice, and I'll give you a lot of improvements, lot of improvement you will have in your forthcoming sessions. So now I give you 2 minutes. You can voice your opinion. You can give your feedback regarding your today's sessions and how these sessions are benefiting you. Are they useful to you? Before, how you are doing, and now how you are doing. What is the difference, and what these sessions gave you some quality? What type of enhancement did you see in your sessions? You have 2 minutes, 120 seconds.
Yes, certainly this session is will help, because always, like, we are not basically like, as a physicians, you try to communicate the important message rather than you looking for grammar. But as you said, like active and passive voice, it makes a lot of difference. And especially after having few sessions, I can realize like where my mistakes and how can I improve my speaking abilities and avoiding the mistakes. Yeah, that's going to help a lot. And using the connective words, which is very important, because that can give more weight to the sentences. So yeah, I'm going to practice that one. But since I have started to take the classes, and now I think it helped me a lot. So thanks again for your support and advice for me.
Yeah. Now I'm going to tell you 3 phases in your learning. First one is identifying the mistakes. Identifying the mistakes is very, very crucial, because unless and until you identify the mistakes, you cannot have the place to improve. You do not have the room to improve. Second thing is correcting rectification process, means correcting the mistakes. This is the second stage. Only you can correct, you can rectify your mistakes only when you can realize that you are doing some mistakes. So you should be wise enough to understand what is right and what is wrong. So once you start, and this you cannot do it on your own, because you are a learner, and somebody who is an expert only can tell you. So you should be with somebody who can correct you. So somebody who can pinpoint your mistakes. Then they will tell you the corrections, because you cannot correct yourself, because already there in your brain, is there in your blood. So the mistakes will happen repeatedly. So unless and until an expert suggests you the correct things, you cannot improvise your quality. That's the point. Next, third one is improvising the subject matter. How to improve? So 50% will be correction, and the next 50% will be improvising. Because once you are correcting yourself and you are well versed with that one, then the standard should go up. Because when you say active voice, that is also correct. I will explain you the procedure. That's correct. There is no doubt in that one. That's 100% accurate. But still, is that the quality? See, for example, I buy a shirt. I can buy a shirt from the street market or from a branded store. What makes the difference? That is also a shirt which covers your body. This is also a shirt which covers your body. The first one just covers your body, but the second one gives an elegant look. You will stand out among the crowd. That makes the difference. Do you want to be one among the crowd, or do you want to present yourself, stand out among the crowd? That depends on your decision.
Okay.
Is that clear?
Yeah, thank you.
You deserve that quality. You deserve that quality. And thank you for choosing me, for training you, for your training.
No
And
problem.
really, I appreciate, I like students like you who are really, really serious and ready to listen like a small child with complete obedience, because it gives you immense knowledge and motivation. So if you furnish yourself with a lot of wisdom, techniques, strategies, then definitely you will excel in your exam and come out with flying colors.
Thank you.
All right. So that's all for now. The people who are watching on the YouTube, and the doctors and the nurses and all the other 12 professions, people from all the other professions. So this is how we handle speaking sessions. It's not like a normal sessions. These are extraordinary sessions for the extraordinary people who are really dedicated and serious to come out with a grand success in the first attempt right away. And there is no confusion, there is no panic. Everything should be systematic, organized, and result-oriented training. If anybody is interested, any doctor or nurse or any other professional is interested in these sessions, you can subscribe to our course. And speaking sessions or writing or reading or listening or all the 4 skills, you can contact me on my number. It's a +91 98 67360. I repeat, +91 98 778 67360. Grandmaster class is always ready to help those people who are really desirous of getting outstanding results. See you again in our next